theatre and a fully equipped IVF lab. Total fertility management is also comprised, including male and female services. We at Flora Fertility Centre have performed more than 2,000 procedures for ICSI, IVF and IUI with success rate comparable to international standards. And it is we mainly focus on customized, economical and ethical practices with utmost transparency, following all state regulations for ART. Flora Fertility Centre is certified level 2 ART center and a surrogacy center. So IVF services includes IVF counseling service, which also includes genetic counseling. IUI, that is intrauterine insemination procedures, are also included in the services. IVF, in vitro fertilization, ICSI, that is intracytoplasmic sperm injection. TESA, that is testicular epididymal sperm aspiration, surgical sperm retrieval techniques are also we perform at Flora. Sperm oocyte and embryo freezing is also performed. Laser hatching, pre-implantation genetic diagnosis and screening is also done. Endometrial receptivity assays are also being carried away at Flora Fertility. Donor services for sperm, oocyte and embryo, and then genetic counseling services are also we are offering at Flora Fertility. And including this, we have in-house pharmacy, in-house pathology lab, that is an in-house embryologist and in-house andrologist, and a well-trained quality staff. Next please. And this is our doctor team at Flora Fertility, and she is Vandana Aiimm, who is the founder of Flora Fertility. She has done MBBGO and achieved gold medal from South Gujarat University. She has completed diploma in advanced laparoscopy from France. She is practicing in the field of obs and gynaec for more than 25 to 28 years in Patan and Ahmedabad. She is owner and director of Lady Care Women's Hospital, which is a building away from Flora Fertility. And she is also owner and director of Flora Fertility Centre since 2016. She is a member and official advisor in Endometriosis Management Committee. She is a past member of several prestigious organizations and committees. She has special and keen interest in infertility, advanced fetal sonography, high-risk obs and gynaec practices, which includes advanced laparoscopy. Next, please. And he is one of the pioneers in Flora Fertility. His name is Dr. Praveen Patel. He is senior, highly experienced and motivated gynecologist and practicing since 1983. After completion of his PG degree in obs and gynaec from Ahmedabad, he practiced in Ahmedabad, Zambia and South Africa. He has vast experience in obs and gynaec, fetal medicine, laparoscopy and hysteroscopy. He moved back from Africa and he came to India to contribute his work at Lady Care Women's Hospital in 2006. He is one of the pioneer members of the team Flora Fertility Centre and dealing with all kind of infertility issues under one roof. And second pioneer person we have in Flora is Dr. Varsha Patel. After completion of PG degree in obs and gynaec from MS University, Baroda in 2003 and 2006, and working there continuously in last 10 years.
Diseases, uterine tube related problems and abortion. In men, they are basically oligospermia, actinospermia and the varicocele. These are the very important factors which are responsible for the infertility in African countries. And in many African countries, as we yesterday were discussing, it's kind of social taboo. So basically, whenever there is an infertility problem, so it all comes over the female, ability of women to bear the children. And being infertile results into a serious psychological trauma, social stigma. In some cases, it may even end up in a social disgrace, exclusion, verbal and physical abuse, marriage violence, and even breakups. So, especially, particularly in the African countries, it is a real personal, social, and public health issue mainly to the developing of Africa. So, this is very, very important. It is not only a physical problem, but it has got a lot of social taboo attached to it. So, we have to create an awareness first, and we have to make people to come to the infertility or fertility treatment centers first. That is very, very important task. And although it is a global issue, majority yesterday we were discussing about the prevalence. So approximately 10 to 30% of the prevalence of infertility is there among the different African countries. Next please. When we talk, why we need to discuss all these things? Because say if you talk about the market, say international market, so it's approximately $12.6 billion. And this was the last figure in the 2023. And now this figure can get double by approximately the next 10 years into the coming period. So CAGR, growth of almost 7%, which is parallel to any healthcare sector in the world. Next. Now, so this was some kind of diagram which was showing that how much infertility actually can prevent. So among the say 1 billion population, 10% would be the cohabitating women between 10 to 44 years of the age. And if 90% of them are fertile and only 10% infertility rate is concluded, then approximately 10,000 female would be there or 10,000 couple would be there where there will be infertility problems. Even if 50% are conservative and 50% only go for the seeking the treatment, because we know that all infertility people do not go to the fertility centers, they don't want to get treatment. In fact, so in some countries they would like to change the partner, then go for the fertility treatment. So this is actually happening in some of the countries in your continent, right? So even if they 50% seek the treatment, then 5,000 would be the number which is required for infertility treatment. Out of those, 40% can get pregnant without, with surgical corrections, with some drugs, some medications, some cycle advice and all that, so they can get pregnant. But still, definitely, sure. Okay. Yes, please.
Is there a possibility for nursing schools services market to consign a memorandum of understanding
Yes.
with the school such that after their training they can come Flora, for example, and a few preliminary techniques are given to them, like preparing a patient for a year, for this and that.
Yes, we had that particular thing in our mind. That for primary, let's say embryology kind of lab, you need to train some microbiologist or a science graduate. So they may have a 6 to 12 weeks of training, and for that particular training, we may charge something for that particular fellows. But they can be trained and they can be used there